Repair of anterior palate, including vomer flap. The physician repairs the hard palate by closing the communication between the oral and nasal cavities. A combination of mucosal and mucoperiosteal flaps are used to repair the defect. The margins of the defect are incised and dissected to develop mucosal, muscular, and mucoperiosteal layers. The mucoperiosteum of the vomer, nasal septum, is elevated and sutured to the mucoperiosteum of the hard palate. This closes the communication between the oral and nasal cavities. Incisions are made in the palatal mucosa adjacent to the alveolar, tooth-bearing, bone. The mucosa is elevated and loosened from the bony palate. The palatal mucosa is closed in layers. Pharyngoesophageal repair. The physician repairs a tear at the pharyngeal esophageal junction. After the airway is secured, the physician makes a horizontal neck incision and retracts superficial tissues to expose the pharyngeal esophageal junction. The defect is identified, irrigated to reduce infection, and sutured in layers. Repair of rectocele. The physician repairs a rectocele, a herniation of the rectum against the vaginal wall. The physician makes an incision in the mucosa of the posterior vaginal wall over the rectocele. The rectocele is dissected free of surrounding structures and the levator muscles are identified. The rectum is plicated to surrounding fascia with multiple sutures and the levator muscles are reproximate. The vaginal mucosa is excised and the incision is closed. Repair of cloacal anomaly by anorectovaginoplasty and urethroplasty, sacroperineal approach. Combined abdominal and sacroperineal approach. The physician makes a small incision in the perineum or an abdomen. The bladder, urethra, and vagina are dissected free of each other. A new rectum is formed by interposing muscle posterior to the rectum. The incision is closed with sutures. Repair of cloacal anomaly by anorectovaginoplasty and urethroplasty, with vaginal lengthening by intestinal graft and pedicle flaps. The physician enters the pelvic cavity through an incision in the lower abdomen and makes a second incision in the perineum from the clitoris to the anal area. The surgeon creates separate openings and divides membranes for the urethra, vagina, and rectum by using intestinal grafts, pedicle flaps, and free skin grafts.